There are research peptides out there that are good and useful. You just have to realize they have no obligation to do purity and sterility research. So they're going to come to you and say, not for human consumption, for research purposes only. Then you're gambling whether or not this is safe for you and is going to do what you think it's going to do.
I'm Dr. Esra Çavuşoğlu, and I've been living a sober life for the past 18 years. My battle with addiction drove me to seek new methods, devices, and supplements to improve my physical and mental performance, enhance my quality of life, and ultimately live healthier for longer. From my experiences in addiction recovery, biohacking, and longevity to the latest global developments, from groundbreaking entrepreneurs to expert academics, the conversations I've had over the years are now featured weekly on Ayık Kafa podcast. I have been using peptides and bioregulators for a while and received many questions from people around me. In this episode of Soberhead, I was fortunate to interview Dr. Suzanne Ferree, who is the senior physician at Wine Medical Associates in Atlanta, Georgia. She's double board certified in family medicine, anti-aging, and regenerative medicine. Dr. Ferree is an award-winning teacher of medical students and residents and has been on the faculty of Emory University, A4M, IPS, ACAM, and SSRP. Dr. Ferree uses bioidentical hormones, peptide therapy, neural therapy, and regenerative medicine to treat patients with endocrine, mitochondrial, infectious, autoimmune, and neurodegenerative diseases. Her practice treats executives and athletes from around the world, as well as patients with chronic or unusual diseases. Her new book, Counterclockwise, is an amazing guide to peptides and more. If you want to know more about Dr. Ferree, please look into the show notes. Without further ado, let's get to our conversation. Here is something that is fascinating. A huge amount of people who watch this channel frequently are not subscribed. So I want to ask you a quick favor. When you subscribe, it helps us to make the show better, access to the world-leading experts, and ultimately bring you more value. All that I ask is for you to hit the subscribe button, and in return, I promise we will make Ayık Kafa better every day. Dr. Ferree, welcome to my Ayık Kafa podcast. I was looking forward for this interview because for the longest time, I am very interested into peptides, and you're one of the leading names who give trainings to clinicians. You were a trainer at World Peptide Congress and now very prestigious A4M conference education. So you're giving training to physicians on peptides and neural therapy, so which is very important. I always like to go to best of the best. So welcome.
Thank you so much.
I know you're in Atlanta, and I've been multiple times in Atlanta. And actually, my dear friend, Dr. Blank, if I'm not mistaken, she got one of your courses. When she was doing a fellowship at A4M, and she was using some peptides. Back then, I guess, tailor-made compounding were able to compound most of these peptides. It seems like now it's in a bit shaky place, these peptides and FDA and compounding pharmacy. But welcome. I know that in your office, in your clinic, you are focusing on human performance and longevity. Can you please explain that a little bit?
Sure. So when I say human performance, I'm talking about athletes, but I also wanted to include human performance. So being a mom, being a student, being a CEO of a company, all of those require us to perform in whatever way. And there are unique injury-prone nutritional needs, unique physical exposures that you encounter in every performance type of place. So as you're trying to whatever the thing is, we always say we like to get world changers back to changing the world. And so that might mean that you're a mom. It might mean that you're a CEO. It might mean that you are in the Peace Corps, and whatever those things are that you're doing. I'm trying to help you to get back to doing whatever the thing is that you love and that helps you to impact the world the way that you do.
And you have an interesting background. First of all, you were trained in allopathic medicine.
Correct.
So like a normal doctor. And if I'm not mistaken, were you in the military?
I was.
Okay, I wasn't wrong. And you also like lifting weight.
I do, yes. So I've been a competitive powerlifter until a year ago, and now I'm bodybuilding.
Oh, wow. Competitive. Peptides help, I'm sure.
It sure does.
What made you switch the field from allopathic medicine to cellular medicine?
It was really a patient demand. The patients came to me asking, what do you think of saw palmetto? What do you think of this bioidentical hormones? And so they pushed me to go and learn more. I also had a group of patients that were getting better and that were doing fine. And then I had a group of patients that were not getting better. And I needed to figure out why they weren't doing better. Their labs that I knew to do at the time were looking normal, and they were doing whatever the normal allopathic treatments were, but they just weren't well. And so in my need to search to help them, to get them better, finding more tools for my toolbox, that's where the research led, but then also they drove me. Story I love to tell is that I wrote a bioidentical hormone prescription to my local compounding pharmacy. And he said, apparently you don't know what you're doing. Can I send you to a conference? So he actually paid for me to go to this conference. And I will be forever grateful for that, because that's what was the sort of springboard for me to then learn more and more about what we do. So I learned about hormones, and a good number of my patients that I thought were Prozac deficient actually were estrogen deficient. And there were several clients that got better as far as performance in their lives goes because of the hormone replacement. And then there still remained this group of patients that wasn't getting better. And so I needed to figure out how to address them. So I continued doing research and came up with peptides, started following peptides from my own injury using some mechanic growth factor and some IGF-1. I was able to recover from my own injury and get back to sport myself. So then, because of that curiosity about that peptide, those two peptides that were so helpful for me, I started doing more research, what else is available. And then as I was one of the first in the area doing that, and expressed an interest in teaching. It's just one of my favorite things to do is teaching. So they asked me to be part of A4M at the time in teaching with them, and then was part of SSRP for a while, and then back to A4M. So that's been part of my life for a while.
Let's talk about what is cellular medicine.
Sure.
Because everybody knows allopathic, what it is. People who listen to me, they know that I'm not very much in favor of modern medicine, which is allopathic medicine. Can you explain what is cellular medicine?
Sure. It's a different focus. So when you go see a regular allopathic doctor, they're going to come in the door and they're going to say, oh, you have high blood pressure. Here's you have a disease that you're bringing me. I'm going to give you a medicine to treat that disease. It's a 1-for-1. And you wait for the patient to come to the door with their disease. The way I'm looking at medicine differently is I'm looking at what is wrong at the cellular level. So not just, oh, I have high blood pressure, but realizing that high blood pressure is actually an expression. It's really a way that the body provides a solution to a problem. And so in some ways, it's really beautiful. And we want you to embrace thank you so much, body, for creating this solution. But it's not really the solution we need to continue to follow. And we need to look at what's happening at the cellular level, because it's not just affecting your blood pressure. It's not just affecting the reading on a blood pressure cuff. It's actually affecting the blood flow in the heart, in the brain, in the genital organs. It's affecting the intestinal function. So everything is affected. And then let's get down to why this is happening at the cellular level. So how is the cell making energy? How is it using energy? What are the not only genetics, because that plays a part, but the epigenetics that are contributing to the way that the cell responds to the problem it's encountering? And how can I influence in very small ways, naturally as much as possible, the way that the cell responds to a stimulus or responds to what it sees as a problem, and influence the solution it chooses in a more positive and productive way for the tissue and the organ and the organism as a whole.
That's a great explanation. And after healing that person, per se, then I think you guys are trying to keep the person as healthy as possible. That's very different than regular medicine.
Right. So then what I'm doing is, I'll see the patient. Often they will be brought to the table because of some symptoms they're experiencing or because of something that is keeping them from doing what they want to do. But then when we get them back to doing what they want to do, I'm seeing them on a periodic basis, usually every 3-ish months, depending on where they live in the country or the world, and trying to keep on top of what's happening, because life happens age happens. We want to make sure that I keep you as healthy as possible, or that we keep you as healthy as possible as a joined group. How do we keep you as healthy as possible as you're going, so we prevent the diseases of aging and the diseases of things? We can't, life happens. You're going to have a family member die. You're going to have a job loss, whatever the things are that occur to us. How can we help you to navigate those in a more positive way? So it might even be sitting down teaching you how to meditate. I might be teaching you a recipe. So there's lots of things that are happening in that environment, but then there's also things we're doing to intervene, adjusting your peptide stacks, adjusting your hormones for what your body needs at the time, what might be happening in your life.
Wonderful. Because you already opened the door to peptides, let's start diving in, because I listened to many podcasts that you were a guest, and I kind of know what you guys are doing there.
Wow, thank you.
Yeah, I study my guests very much so. And I also read your book, Counterclockwise. It's a very easy read. Everybody should read, because you give these real stories, and you tell the real story, then you share how you're approaching to that problem, which is very easy to understand, actually. And these are all people around my age, actually. If somebody came 51 years old, like 48 years old, so on and so forth. So these peptides had been my attention for a while now. I started using them it's probably 8 years ago. It was Epitalon, the first one that I used. I didn't even know. I was prescribed by my doctor friend, Susan Blank. I used it for a while, for maybe a good 5-6 years. Then suddenly it disappeared, and instead something else came. And lately, since I started these podcasts of mine, I'm like, let me see what they're doing. And it's an amazing health enhancer, let's say, in a way, because it's not like just treating things, but it's also making things well. What are peptides?
So we, by convention, call a peptide anything that's a string of amino acids under 50 long. So what are amino acids? Those are the building blocks that we think of, like a chicken breast, for example. That gets broken down into, we know it's protein, mostly. Chicken breast is mostly protein, a little bit of fat. But the chicken breast, that protein that's in there, as it's transferred in the body or works in the body, it gets broken down into smaller and smaller fragments. By convention, the amino acid strings that are longer than 150 amino acids we call them protein. Anything between 50 and 150 amino acids, we call it a polypeptide. Anything under 50 amino acids, we call it a peptide. The ones that are 4 amino acids or less, we call those bioregulators, because they actually can get into the cell, into the nucleus, and affect the way that DNA is transcribed. So that's the just sort of vernacular of peptides.
How did we first figure out about these peptides?
So in the 1920s, there were some researchers doing work specifically on digestion and on the proteins that were secreted, or the peptides at the time that were secreted. Secretin was one of the first ones that was discovered. You're probably most familiar with one that was discovered around the same time, oxytocin. A lot of women who had babies, Pitocin is a synthetic version variant of oxytocin. So it was one of the very first peptides to be studied back in the 1920s. So we've known about these for a long time. They've, of course, been in our bodies as long as humans have been, or creatures have been. Amino acids and peptides have been around for a long, long time. But we discovered them back in the 1920s, how they are functioning as signaling molecules in the cell. So they bind to receptors on the cell and then set off a signaling cascade that allows the cell to change its expression, the way it's doing things, the signaling that it's doing to the environment around it. And that's why we're so excited about peptides, because they have the ability to influence the cell in a very natural way. And we know that these diminish with age. Peptides in general diminish with age. So your body is making less of the ones, particularly the ones that are more involved in the more youthful expression of your cell, the more efficient expression of your cell. This is one of the reasons why we age and ultimately get disease, is because of that not happening any longer. So as we can influence the effect on the cell with these signaling molecules, were able to allow the cell to do a different thing and the body to behave in a more youthful manner, as well as to overcome the expression of disease based on what the environmental exposures or the genetics happen to be.
What are the original peptides that people who are listening to us would not know them as peptides?
Sure, there's a ton. Like insulin is a peptide, growth hormone is a peptide, losartan, which is a blood pressure medicine. I don't know what you call it in Turkey, but losartan is a peptide. Basotracin is a topical antibiotic that a lot of people use for MRSA. It's a peptide. There's the ones that have come out recently, the one like Ozempic, the brand name for semaglutide, that's a peptide. There's some CGRP, new migraine medications that are CGRP2 agonists. And those are, or antagonists, those are also peptides. So there's lots of places where peptides are being used right now that we don't even know that they're peptides. We just call them by their chemical name or their brand name, but they're actually peptides, and they've been around for a long, long time. For example, we used to get insulin from cows or pigs or other humans. And so now we're able to actually create them in a lab. So the reason why peptides have exploded in popularity or familiarity, at least, is because about 15 years ago, we were able to create, I say we, I wasn't there, it was some smarter researchers than me, were able to create these in a lab where they could synthesize exactly the amino acid sequence that we have in our bodies. And they were able to produce them in mass quantities. So before, it had to either be extracted from another organism or it had to be painstakingly created in a lab. And because this new, more simple process was available to us, all of a sudden, that's why you're hearing about them and they're so popular. One of the problems is they are natural to our bodies, and at least in the US, you're not allowed to patent anything that is natural to the body. Anything natural, you have to modify it slightly in order to get a patent. And so if you don't have a patent, you can't protect your information, and therefore you might have a competitor that's close by that steals your product information. So this is sort of a problem for us because we need to, the companies need to make money off of what they're spending thousands and thousands of dollars producing, but the people need the modification of their cells. So we're sort of in a difficult balance right now.
Based on my knowledge, there are still these peptides or bioregulators taken from some organs, like some animal organs, correct?
So many of them, especially right now, a lot of the bioregulators do come from animals. So, for example, Dr. Cavinson's, rest his soul this year, his research that was done with all of the bioregulators, including Epitalon, all of that was done mostly in Russia, some in the Ukraine. And his amazing work that he did with the longevity, especially with the pineal gland and thymus gland peptides, bioregulator peptides, in supporting longevity, that was really an amazing group of research. And there's several huge studies. I think 11,000 was in their Gazprom study. Super impressive. And the ability to extend life in healthy years was also really impressive in their studies. Those studies are being replicated now. So hopefully we'll get continued positive results.
Is that story correct that Professor Cavinson was called by Russian authorities and say, like, listen, our cosmonauts and our soldiers are really getting damaged after their long journeys? So go find something to make them better. Is that a true story?
And they're submariners, yes. Exactly. Exactly. So because of the radiation exposure, both with their submariners, the Russian government put a ton of money into those huge research studies. The intention of the study was to provide the gas company, which is Gazprom, the ability to keep their workers working longer and healthier. So fewer sick days. That was their intention. And their long-term results were really impressive. But yes, it started with the submariners and the cosmonauts to try to keep them healthy as long as they could. They also did a lot of research with their Olympic athletes. So a lot of their human performance research comes out of the Olympians.
Yeah, whomever I speak about this stuff, like actually many people, doctors, researchers, they're like, if Russians did it, we believe it.
Right.
It seems like there's this understanding that they don't joke around. If they do something that's definitely powerful and it's working.
And you know that people took the medicine, right? They took it every single day. If their government tells them to take a medicine every day as a part of a study, you know that the patients are taking it every day.
Now we're able to, we meaning the pharmacies, compounding pharmacy and some research companies, let's say, they're now doing these peptides synthetically.
Correct.
Yeah, including Epitalon, because it can be from animal or synthetic, correct?
Correct, exactly.
Since I dived into this peptide world and trying to self-experiment in a weird way, hopefully I'll be a good candidate for my Turkish people. But now I have great doctors like you guys around me, guiding me. But it seems like they're like these miracle, magical compounds, from skin to injuries to brain health, immune system, hormones. It's such a big variety that these things are supporting one's system. So let's start like that. So how do you approach to a client came to you healthy, let's say, like I came to you, I said that I'm 53 years old, I'm healthy, and you ask me like, what's your goal? My brain to work better and, in general, support my system.
For someone like you, I would start with the very basic, simple treatments. Number one would be a thymus gland peptide, and there are a few that we have available to us. I would choose something like Thymosin Alpha 1. We know that that's depleted with age. We know that the thymus gland is replaced with fat as we age, so it doesn't function quite as well. So our immune system, which comes from the thymus gland, is not functioning as well. This is why we get sicker as we get older. It's why our older family members did not fare as well in the recent pandemic. And so I would start with something like a thymus gland peptide. Maybe not every day if you're not telling me that you have symptoms related to your immune system. But if you're coming to me saying, hey, I feel great, I'm going to say you probably should be on a thymus gland peptide, primarily because of your age over 35, but over 50 for sure, we would want to do some sort of thymus gland support. The second thing we would do would be a growth hormone secretagogue, and there's several of those available. There are a couple of oral ones. Most of the ones I like the best are injectable. And so for someone like you, I would choose something like tesamorelin. Merely because it's once a day, it's 5 days a week, it's very effective. We can get a pretty robust response in the growth hormone level. You're not going to overdose like you would with growth hormone itself. And so this is the reason why I would choose both of those. The growth hormone itself has so many cellular benefits in improving energy use, in improving energy creation, in allowing the cells to choose to burn fat as a substrate, and allowing the cell to create more mitochondria so that they're way more energy efficient. So just in general, that's what I would choose the two of those as a baseline. If I'm thinking in general about your concern of cognitive health, it's curious because the most recent peptides that's been so famous with weight loss, the semaglutide, originally was studied as a cognitive enhancer to improve the insulin sensitivity at the cellular level in the brain. So again, thinking in terms of cellular medicine rather than thinking in terms of disease medicine. So disease medicine is I'm treating dementia, I'm treating Parkinson's. If I'm instead thinking about insulin resistance, the way the cell is unable to receive the nutrients that it needs from its environment, that's what insulin resistance is. And so if we think about that at all levels, not only the pancreas and the muscle, but also at the brain cellular level. So that's why something like a semaglutide is going to work, or the GLP-1, the original peptide, is going to work at all of those levels. So I'm going to get cognitive enhancement by using something like that.
Let me ask you a question here, because I know it helps to other things besides losing weight. A couple of clients of mine that, it's very famous now. People want to lose weight faster. And I encourage them, because if they don't exaggerate, if they eat enough protein, if they lift weight, it's going to help them something that they're stuck at. And also I tell them that it's it has other benefits now that you started saying. So how does it help the brain? So you said that it was first discovered for Alzheimer's disease and Parkinson, I guess.
It was originally studied for neurodegenerative disease because of its ability to help the cell receive nutrients better. An aging or diseased brain, for whatever reason, toxic exposure, infection, etc., is going to trauma, is going to receive energy. The cell itself is going to receive energy differently. That the expression of that is Alzheimer's or ALS or MS or whatever the expression is. But at the cellular level, the cells are struggling to get the nutrients they need, to get rid of the toxins they have. That's what's happening at the cellular level. So if I can help that along by using something like a GLP-1 agonist that is going to cross the blood-brain barrier, then we're getting the cell to be able to do its own work, to be able to solve the problem itself. And again, the expression of dementia or Parkinson or whatever are the cell's solution to the problem that they see. And the problem is I don't have the ability to get the nutrients I need and get rid of the toxins I don't need.
Can they pass blood-brain barrier?
Yes.
Just to be clear to the audience, we're talking about the Ozempic, the Munjaro, and also the peptide versions of GLP-1 agonists. Okay.
Correct.
That's great. Another very interesting question came to my mind, the thymus gland. Do you believe in these tappings is going to make a difference? Because, I keep hearing like you no longer have the gland there. There's a big fat sitting in your chest. So do you think tapping would change that?
I think tapping is amazing for resetting your autonomic nervous system. I'm a big fan of that. I think it's very, very helpful. I haven't seen the research on specifically doing the thymus gland. I know the research on using a growth hormone secretagogue to reverse the thymic fat fraction. So that's why I would choose. So the recent TRIM study that came out talking about growth hormone and the thymic fat fraction and reversing that, it's part of the reason why growth hormone or growth hormone secretagogues are so important in the anti-aging and longevity space because of their benefit on the thymus gland.
I recently did a program about Alzheimer's disease, and it's a huge growing concern about older people, obviously. And people, like you said, only looking to the problem and not looking to why it's caused. Any of these peptides, whether Cerebrolysin or a bunch of other ones that you may want to count. So how these brain peptides work? Because there are a bunch of them, correct?
Correct. Yeah. There's an oral one called Dihexa that works on the angiotensin system, also increases BDNF. Most of them, that's how they work, is by increasing BDNF, brain-derived neurotrophic factor. So allowing the brain to go into this growth mode rather than staying in this retracting atrophy mode, which we see in most, if you do MRIs or CTs of brains of most older adults, you're going to start to see this cerebral atrophy that begins to occur. And so what we're trying to accomplish with using many of the brain peptides is from different places in the system to allow the nerves to regrow. Now, part of the requirement of using any of the brain peptides is you have to do something to stimulate your brain. It's just like going to the gym. And if you're trying to gain muscle, but you're not going to the gym, you're not going to gain muscle, right? You have to do something that's traumatic to the system. So learning a new skill, one of the best things to do is learn an instrument, learn salsa dancing because you use the top of the body, the bottom of the body at different places. And then you have to learn all the steps. So it's memorizing steps as well as top of the body, bottom of the body, moving in different directions. There are other things that are very similar to that, but those sort of things can be really helpful in maintaining brain health. Probably the most important thing we do is avoiding environmental toxins. So in whatever ways we can, be participating in some sort of detoxification program, but also like detoxing your home from whatever exposures you may have. One of the biggest ones in the state where I live in Georgia is mold toxicity because of so many buildings are water damaged. Where we live, it's very humid. And so there's a lot of water damaged buildings here. So mold can be a real toxic toxin for the brain, it can really be a problem. Any infection can be a problem and can be a toxin for the brain. Also, any sort of trauma, so traumatic brain injuries need to be addressed immediately. And then one of the big ones that we have is alcohol. So limiting your exposure to that toxin, realizing that when you get that light tipsy feeling, that is toxin in your brain. So whatever we can do to limit our toxin exposure can be really beneficial to the brain.
It seems like Cerebrolysin is used in Austria immediately when you have a head injury.
Yes.
What does it do? First, let's say what is Cerebrolysin. I guess people who are watching may not know.
It's a complex of peptides. In that compound of peptides, it works on decreasing inflammation, improving healing, and increasing the ability of the cell to grow. So to develop new dendrites, to develop new growth so that it's able to work. So starting Cerebrolysin immediately. There are other peptides I would use if there is a traumatic brain injury or a stroke. I would use Thymosin beta-4. I would use BPC-157 because both of those have evidence of benefit in reversing the effects of trauma, both the blood flow trauma and the direct, impact trauma.
I heard that you also use Cerebrolysin for high performer business people.
Exactly. You're trying to maintain that cognition where you're functioning every day, keeping that creativity going. So what I hear my clients come back to me and say, so I have a guy who's an international furniture fabricator, and he comes to me and says, after we started him on the Cerebrolysin, he comes back to me and says, hey, I am having trouble with remembering things. And especially I notice it when I'm trying to play guitar, because this is his hobby, his relaxation. I can't remember the sequence of chords like I used to be able to. And he's under a lot of stress. He doesn't sleep super well. We're addressing all of those things. But the Cerebrolysin, just doing a course of that, he was able to get back and be able to recall series of chords to be able to play a song, which is huge for him because that means he gets his relaxation again. It means he's able to get his sympathetic nervous system under control. So maybe he's actually able to sleep.
And these peptides can be done in multiple ways, correct? Subcutaneous, IV, some of them are pill forms, but Cerebrolysin is best IV use or intramuscular?
We either do an intramuscular or we do IV. I think depending on the case, if the patient is a brain trauma, either stroke or direct trauma, then I would probably do IV. But if we're just trying to improve daily human performance, then I'm going to do a sub-Q even. All of those are possible. It depends on the peptide. Some are available sub-Q, some are available IV, some are available orally. Like Dihexa is available topically and orally. And so I will give the oral dose often because it's just easy. And then I can rotate that with the other peptides for brain health.
So there are other ones like C-Lank and C-Max as well.
Correct.
I read in your book, and I'm afraid to apply. Everybody who listens to me knows that I have a huge sleeping disorder, and we're doing so many things to resolve it. Sometimes it gets better, sometimes worse, depending how much I travel. And by the way, before everything, I thank you because I did the VIP sprays and it really did help me. Even mornings that I woke up like at 5 a.m., I had like the energy as if I slept until 8 a.m. So worked perfectly. So thank you so much for that suggestion. In your book, you say about the C-Lank and C-Max that sometimes you prescribe that for your clients who are having sleep problems.
Correct. We'll rotate them around.
The reason I'm asking, it's kind of like if it makes the brain work, it just makes me always afraid. Like it sounds like nootropics, these peptides to me. I'm like, would you be very hyper even?
They work by different mechanisms and specifically by working on GABA, much like any other GABA enhancer would. Lots of other GABA enhancers out there like DHHB, et cetera, that's working on enhancing the ability of the brain. So we have all these excitatory neurotransmitters, histamine, dopamine, serotonin, norepinephrine, all these acetylcholine, excitatory neurotransmitters. And we really have GABA as our only calming neurotransmitter. So if we're constantly being stimulated and not getting that GABA to calm down for lots of reasons, then we're going to have trouble. So that's what we know that Cmax does. The C-Lank, it's actually a fragment of IgG. So it works by being an anti-inflammatory. So one of the reasons we have trouble, inflammation is a Goldilocks, meaning you don't want to have too much and you don't want to have too little. There's a just right. So if we can decrease that inflammation in the brain to that perfect spot so that you can actually sleep, because you need a little bit of inflammation to help you sleep. So if you have just the right amount of inflammation, then you'll be able to sleep. So what we're trying to do is get down the excessive inflammation to a reasonable level to allow for sleep at night.
So then these peptides support the brain health in a way.
Correct.
The other one, Cerebrolysin, Cortexin, they're more rebuilding.
Growth.
Yeah, rebuilding. And the C-Lank and C-Max are more like supporting the brain from anxiety. It seems like it helps the anxiety.
Correct. And of course, I think that it would be super helpful to throw in there, don't forget about the GLP-1 agonists. I think those are really helpful for brain health, again, at the cellular level, helping the brain to be able to use and create energy in a more efficient way.
I'm sure every woman is expecting and waiting for this moment for beauty, because I know that you are a part of a skincare product, which I use, and I love it. So let's talk about the beauty.
Sure.
The stage is yours. Tell all the peptides. I'm sure everybody's going to run now towards these peptides.
So I'm going to go back and reiterate that I think that the growth hormone secretagogues are super helpful for maintaining collagen, maintaining the structure of the face in general. I think those are really helpful. And in fact, when we're using the GLP-1 agonists for weight loss, a lot of times women will have that, they call it Ozempic face, where their face sort of falls. And if you have a patient on a growth hormone secretagogue at the same time, they don't get that face fall like you can get when you're using it alone, the GLP-1 alone. So that would be one of the things I would add in just on a daily, regular basis, making sure that people are able to maintain that lovely structure under the skin. And then there's another peptide that's a bioregulator called GHK-Cu. GHK is the amino acids that are in it, plus a little copper. The copper is necessary for production of collagen, but also copper, the GHK, goes into the cell, goes into the nucleus, and changes the way that the cell expresses itself. So your natural stem cells in your skin, your fibroblasts, actually become more stem-like, meaning they're able to help with repair more easily. So sun exposure on a daily basis, they're able to help with repair. The toxic exposure that our faces go through every single day, just because it's exposed, it's out there. It's for the sun to see, for radiation to see, for everything to see. And so helping with toxic exposure, the GHK really changes the way DNA is expressed so that the cell is able to be more youthful. And so that's why we use, I really love that GHK as a skin youth peptide. It has some interesting research head to head with retinol and vitamin C and shows more benefit at wrinkle reduction, at skin elasticity, et cetera. So those are two that I would definitely consider using. If we're talking about body composition for, beauty, body composition.
Sure.
And I think that's really important for us to embrace, as opposed to weight loss, for us to instead embrace body composition change. So it needs to be part of a regimen, obviously, including the way that you use food, that you choose the food that you bring into your body, but also the way that you move your body on a daily basis, some sort of activity level that you're doing regularly. You don't have to do competitive weightlifting or bodybuilding or anything like that, but certainly some sort of resistance exercise on a consistent basis is so good for all of us. Because that resistance exercise is going to increase natural production of myokines, which are peptides that are going to, again, tell your body this is a youthful body. Let's tell the cells to do what they need to do. So it's not just for exercise and for weight loss. It's for the production of proteins in your body, those myokines, to help with decreasing inflammation, to help with improving the way the cells function. And so then we add on top of that something like a GLP-1 agonist and a growth hormone secretagogue There are several others. I really love the mitochondrial peptides for their ability to help with body composition. So we're losing fat, we're gaining muscle mass, and all of that contributes to patients becoming more beautiful. So there are some peptides we use for hair growth as well. I know that people are concerned about their hair.
And which one is that?
Topical application of GHK, of thymosin beta.
So GHK without the copper or with the copper?
With the copper. If I'm injecting it, I don't use the copper because the copper stings a lot. So I'll do GHK without copper and have them take copper orally.
They scared me so much about it's going to burn, it's going to burn. Then I bought the regular one without the copper. Then I never used because people says it's not going to work too much if you don't know your copper levels. I'm injecting myself now with GHK copper and it's a tiny bit burning. Believe me, Mots-c is burning much more.
Way more.
That stays like a whole day, if not until the next day. So mitochondrial peptides, you said, which one are they?
So there's several available. SS31 is one of my favorites because it's a bioregulator. It's tiny. And then Mots-c, mitochondrial peptide. So your mitochondria, if you don't know, the mitochondria actually has its own DNA. And so not only is it an energy generator, but it communicates with the nucleus to tell the nucleus what to do and where we are as far as the cellular health. It's sort of a barometer. So if the DNA that's in the mitochondria, we can actually give that to you, the proteins that mitochondria produces, the peptides, we can give that to you as an injection. As we age, our mitochondria become less functional and those peptides are less available. So that's why we consider. So Mots-c is one. SS31 is one, and then humanin is the third one that are available generally right now.
If I'm not mistaken, I heard Mots-c also kind of, they say, exercise in a bottle.
Absolutely, yes. It's an exercise mimetic, a calorie restriction mimetic. It's really excellent. Where we primarily use it is in our athletes as they approach competition. So this will be augmenting what they're able to do because as they approach competition, their recovery time is shortened. Their workouts are harder. So we're just trying to help them get to their optimal function as they go. And of course, that applies to other people who are, like I said, human performance. So whatever your human performance is as that ramps up.
About the GHK copper, let's go back to that. When you said topical, it works as good. It seems like if you inject, so then it's helping the whole system. How does it work?
Correct. So it works at the cellular level in every cell to change the expression. So the original research was done by Dr. Picard in 1972 using liver. And what he did was examine the proteins that were produced by the liver without the copper GHK-Cu and then with. And what he noticed was the proteins that were produced or the peptides that were produced with the GHK-Copper were the more youthful ones. The livers that were exposed to the GHK looked very much like a very young liver as far as its protein production. So, of course, we're just showing that this is a much more youthful expression of the cell, which is what we all want, is so that we're able to do that. So it does, GHK-Copper does that at every cell level. So you're getting that effect everywhere. It goes into the cell, it goes into the nucleus, affects the expression at the DNA level. We know that it up and down regulates something like 600 different proteins in the body, the expression of those DNA. So it's very, very effective at the DNA level at changing and up and down regulating the production of proteins.
Let's touch base on managing the gut issues because we all know that, your gut is connected to your brain. And if your gut has problems, then, actually everything has a problem. Besides eating good, not eating seed oils, whatnot. There are very amazing things, these peptides like BPC 157 and so on. But I'm going to ask you, so how does it work? Some as a pill form or a cream form helps the skin or the gut. For the gut, do you need to take as a pill? And how does it work? It seems like it's a miracle peptide that you guys see a real change very fast.
Correct.
With the BPC.
If they have an intestinal issue, I'm going to ask the patient to take it orally, ideally, and injectable, because we're getting both sides of the intestinal health by doing that, right? If I'm taking it by mouth, I'm really treating the mucosal layer, the intestinal epithelial cells. If I'm injecting it, I'm treating the entire gut from blood flow, et cetera. We're getting all of this. One of the main ways that BPC works is by improving nitric oxide and the ability to produce the healthier nitric oxide, the production from the nitric oxide synthase, so that we're improving the ability of the cells to get that blood flow to the area. So if we're getting blood flow, we're getting nutrient delivery to the cells so that they can do their job. Everything's about getting the cells healthier so they can do their job. So I'm going to have patients take a capsule. They're going to open the capsule, take the open capsule, then they'll take an intact capsule, because obviously the capsules are to help prevent problems, to allow the BPC to get past the stomach. The capsule prevents you. And so but I sometimes will want patients to get esophageal and stomach. So that's why you open the capsule and take one intact. We know that patients will start to gain a little bit of weight once they get healthy, once their injuries are repaired. I don't mean massive weight gain. I mean 4 or 5 pounds. And then that's how I know it's time to stop taking your BPC. Oh, good. Excellent. Great job. It's okay to stop taking your BPC now. We know that the repair has occurred. So most of the research was done in esophageal or gastric ulcers. Then we started doing, and most of the research was done in animals. There are a few human studies. Both of them were done in arthritic joints. So that's the 2 human studies that are available. I think there are 12 patients done by Dr. Lee. But really fascinating results, intra-articular injection of BPC. There's also an interesting study about intra-articular injection of the original liraglutide into the joints. So that's another study, another talk for another day. If we're talking about intestinal health, I can't not talk about larazotide, if you're familiar with that. And it's another oral peptide. Larazotide works specifically on tight junctions. And most of the research that's been done on it is in patients who have celiac disease. So those patients will have, because of gluten, they'll have damage to their tight junctions. Other things damage tight junctions. So this is where cellular medicine comes in, because the research is done with celiac disease. And so everyone's going to say, oh, this is a medicine for celiac disease. Well, if I know that it works at the tight junction and I know these other 5 things affect tight junction health, maybe I can use larazotide to treat those other 5 things as well. And that's been the case in my experience. So we know that high cortisol levels will break down tight junctions. We know that intestinal infections will break down tight junctions. So this was definitely in my armamentarium for treating the most recent viral pandemic that we experienced, because we know that bug caused a lot of intestinal symptoms. We know that that's where it collected, and that we can get some improvement in those tight junctions by treating with something like larazotide because of its mechanism of action.
Oh, wonderful. So these tight junctions are also when they're not tight anymore, it's the leaky gut and stuff happens.
Correct. You are absolutely correct. And I remember being in surgery residency years ago. I was a surgery resident first. And I remember talking to the surgical attending about leaky gut, and he thought I was crazy. And this was, 25 years ago, talking that leaky gut doesn't exist. And now we actually know, because of all the research in tight junctions, that it does really exist. So
you were also saying that, before we started, there are some peptides to help the sexual health.
Correct. So it depends on what our goals are. The number one peptide for sexual health, it's actually available right now as a brand name. It's called Vyleesi in the United States, but it is available, compounded as well. The mechanism of action, it is a fragment of melanocyte stimulating hormone. So we know the brain produces melanocyte stimulating hormone. A fragment of that peptide is beneficial in stimulating libido. So it's interesting because it doesn't work at the genital level. It actually works at the brain level to increase your interest in sex. So this could be used, you can imagine, in combination with other therapies. In our practice, that's one of the things that we do. So that specifically, it works. Interestingly, it's one of the only ones that's better at higher doses in women. Men don't quite need that high of a dose. And it improves their erectile function, partially by improving their cognitive function. So improves their libido at the brain level so that their body responds appropriately. And many men will come back at a relatively low dose and say, yeah, I had great response, as opposed to some of the other therapies that are available. One of the downsides is the onset of efficacy is not super predictable. So it can be anywhere between 4 and 8 hours after dosing. And then a lot of people will develop some nausea at the beginning, and it's transient. The nausea usually lasts about 15 minutes. If your onset is unpredictable and you have a little bit of nausea, it might be distracting to try to use this. However, persistent use will mitigate those side effects. And my experience has been that patients get really great outcomes and they love using it once they get into a twice weekly dosing. So one dose will last you around 72 hours. So that's pretty helpful. The other things we can do is gonadorelin, which is a agonist it's a GnRH, gonadotropin releasing hormone. So that goes then from the brain to the pituitary gland, causing release of FSH and LH, which stimulate release of estrogen, progesterone in women, and then testosterone and sperm in men. So we can get some really great results using that in our patients as well. And then kisspeptin is also available as a stimulant of release of FSH and LH from the pituitary. So in slightly different ways, we can use kisspeptin, we can use gonadorelin for helping people to be able to produce their own peptides naturally.
Wow, I'm sure people are lining up after hearing all these wonderful outcomes, especially women, because it's harder for them.
Correct.
To produce that much desire.
Right.
Dr. Ferree, now that we kind of explained most, if not all, the peptides, why it cannot be used all the time? You guys are suggesting to pulse it, to use it 6 weeks, then stop, whatnot. So why is that, if it's that great?
Right. So our receptors become sensitive to the peptide being stimulating the receptor. And so we want to allow the receptor a rest and then restart. So I will use most of them in sort of a 6-week to 3-month cycle, and then I'll change that. I really love the concept of seasons and starting something in the spring, then starting something in the summer, starting something in the fall, something in the winter. So we're changing what your body needs depending on what your activity is. Our activity is different, so your body's going to need something different. So we're going to follow that sort of not only circadian and daily rhythm, but also the seasonal rhythm of the body by changing things every 3 months. So probably mostly because your needs are going to change, but also because I need to allow your receptors a chance to rest and then reintroduce the peptide to the client.
If I'm understanding correctly, these peptides are supporting the peptides that we had organically with age start losing it. And you said something around like 35 years old?
Correct.
Slowly declining. I heard that 35 over there. And basically, it's supporting what's missing. When you use it, doesn't mean that it's going to stay there.
It signals a change and then allows everybody. It's sort of like the CEO of a company has a new idea. And it comes in and says, all right, guys, this is what we're going to do. Go do it. And it casts the vision for what it wants you to do. And then all the other pieces of the cell that normally run the cell go and do what they're supposed to do. So yes, most peptides are gone within, 30 minutes max. So the actual peptide itself is not continuing to stimulate the cell. It stimulates and then goes away. The difference would be the GLP-1 agonist that's modified slightly, the ones that are commercially available that are modified slightly so that they stay around for a week. Most of the peptides that are available to us go in, stimulate the cell, create a cascade of change, and then everything happens as a result, right? So that's why you don't have to give it all the time.
Yes, I understand. Maybe not for the brain one. But when it comes to, let's say, GHK-Copper or growth hormone secretagogues, you need to continue. If even you pause, you have to continue because at the age of, let's say, I'm 53 years old, and I'm no longer producing most of these.
That's exactly right. So I have most of my patients on some sort of growth hormone secretagogue continuously, and then some sort of GHK and some sort of thymus gland peptide continuously. There's so much research to support that. There's no reason not to, especially we know that people as they age, there was a big study that came out studying elderly men when their growth hormone levels are lower, that they're at higher risk of death from all causes, car wrecks, cancer, everything. So we know that with the decline in growth hormone, you're at risk for death from all causes. And so then we know from the TRIM study that there's an increase in longevity of a couple of years if you use growth hormone. So this is the reason why we promote using something like a growth hormone secretagogue that's going to give you that extra boost. And I've seen clients in their 70s and 80s that are doing really well. They're able to get back to the gym. They're able to get back to function. Their recovery is faster. That's the reason why we recommend them. So yes, GHK we use continuously. I just have people watch the lunas of their nails. So far, I've never seen anyone have a problem with copper toxicity. And we can treat that just with giving them some extra zinc. So those for sure. And then the thymus gland peptides we also do fairly continuously.
Do you use any other medication? If these peptides kind of supports most things in your practice, do you use any regular pharmaceutical? Unless someone comes with an illness, let's say.
I'm trying to think of what I might use on a consistent basis that are, maybe if they absolutely have to have, there's lots of other things that we could use for. We use a little bit of ivermectin. We use, a lot of our patients have sort of chronic viral illnesses. And so we'll use a bile acid sequestrant. There's a couple of them that are available. One is called colesevelam. The other one's called cholestyramine. We'll use those. That's probably a big one that we use is the bile acid sequestrants, trying to help patients be able to detoxify more efficiently when they're initially not able to do so. And then those are probably our big ones. I use a little bit of the nootropic modafinil. We'll use that a little bit, depending on the patient.
But because you're so fluent with peptides, I think I have a feeling between the hormones, the neural therapy, and the peptides, you kind of are able to manage most clients.
And nutraceuticals, correct. Yes.
Nutraceuticals, yeah. That's amazing. I mean, this is such an interesting world, these peptide worlds, that this conversation can go on forever.
And there's so many more being discovered every day. As frustrating as it's been for many of us about the FDA pulling the ability of the compounding pharmacies to make these peptides for us, what's been exciting about it is it's generated creativity in the researchers. So now we're researching and discovering, especially with AI now, we can do a lot of that research virtually and be able to look at strings of amino acids and see what they do in the body without having to do experiments on humans initially. And so it's pretty exciting to be able to do that. And the fact that the FDA made that declaration has only allowed us to be way more creative in discovering new peptides that are out there. So that's been really exciting. There's some new weight loss peptides, BAM15's coming out, and SLU. So super exciting ways to help patients do better in general, and probably, especially with the neurodegeneration and then cardiovascular disease, I think that's where we're going to see a lot of this continue to explode.
Do you have any warnings to people? Because I know you guys, you doctors that are very, as I said, fluent in peptides, you look to these research-based peptide shopping, kind of, you look from distance a bit.
Sure. You just have to realize that the way that these peptides are created in a lab, they actually use a toxin to create the resin that's used as the sort of base holder to create these peptide strings in a lab is toxic to humans. It can cause liver failure. And so if we aren't 100% sure that that toxin has been removed, which you have to be sure of that when you're using a compounding pharmacy, you don't have to declare that when you're doing it through a research lab. If we don't have that confidence that you have purity, especially if you're using things IV or subcutaneously, We want to make sure that they're pure. Actually, what it says it is in the bottle. And then we also want to make sure that they have no toxins or microbes in them. That's the reason why I choose to use compounding pharmacies exclusively. There are research peptides out there that are good and useful. You just have to realize they have no obligation to do purity and sterility research. So they're going to come to you and say, not for human consumption, for research purposes only. And then you're gambling whether or not this is safe for you and is going to do what you think it's going to do. So I've had patients who've had great results. I've also had patients who've not had great results. So that's why I choose to still use compounding pharmacies.
Yeah, that's wonderful, because there are also many books out there to show people what peptide is what. But what I know is if you mix the wrong stack, not working
synergistically
with your supplements even.
Correct.
As exciting as it is, it's also something to be very careful about. Dr. Ferree, thank you so much. This was like a very short but very intense podcast. We kind of touched base in most things. Thank you so much. I appreciate you being here as my guest, and I hope to see you soon, probably at A4M.
Great. I can't wait to meet you in person, Nasra.